Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Cancer of the cervix is the fourth most common cancer in women around the world, killing 300,000 women each year. Now, the Pap smear test for early detection cut the incidence of cervical cancer deaths by 75%, and the HPV vaccine to prevent cervical cancer development has recently shown a nearly 90% success rate. That's very impressive. But a 100% success rate in the prevention of cervical cancer remains elusive, and this is where nutrition and other lifestyle factors play a very significant role. Now, in the previous Lifestyle Medicine Update, I reviewed the research showing that more optimal intake and/or nutritional status of dietary fiber, vitamin C, vitamin E, vitamin A, alpha-carotene and beta-carotene, folic acid, vitamin B12, lutein, and lycopene are associated with a reduced risk of developing cervical cancer. As well, small studies have shown that folic acid supplementation can reverse cervical dysplasia, which is a precancerous condition, stage 1 and stage 2 cervical dysplasia, in some women who take oral contraceptives. Now, building on this theme, a report in the journal Oncology Times in 2002 showed that supplementation with a key anti-cancer nutrient found in cruciferous vegetables was able to reverse cervical dysplasia in a high percentage of women diagnosed with this precancerous condition of the cervix. Now, cruciferous vegetables include broccoli, Brussels sprouts, cabbage, cauliflower, bok choy, turnips, kohlrabis. Now, many studies show that individuals who consume these particular vegetables on a regular basis have a lower risk of various cancers, including reproductive organ cancers. Now, in this study, 27 women with stage 2 and stage 3 cervical dysplasia took part in the study at Louisiana State University in New Orleans. The patients were randomized to receive a placebo or a supplement containing the indole 3-carbinol, a very important anti-cancer nutrient found in cruciferous vegetables. Now, women in the treatment group were given a dose of 200 or 400 milligrams a day of indole 3-carbinol for 4 weeks. Assessment of the cervix was performed at the beginning of the study and then every 4 weeks, and each woman had a biopsy at baseline and then after 12 weeks. Interestingly, 7 of 10 placebo patients were HPV positive, as were 7 of 8 patients who were given the 200 milligrams of the indole 3-carbinol, and 8 out of the 9 patients who were given 400 milligrams of indole 3-carbinol. So a lot of these patients already were positive for the HPV virus. At the 12-week biopsy, no patient randomized to the placebo group showed any evidence that their cervical dysplasia was being reversed by the placebo, whereas 4 of 8 patients in the low dose, 4 of the 8 patients who were given 200 milligrams of the indole 3-carbinol each day, and 4 of the 9 in the high dose group who got the 400 milligrams of indole 3-carbinol each day exhibited complete regression or complete reversal of their cervical dysplasia condition. This is amazing. In fact, the higher the dose of the indole 3-carbinol, in other words, the group that got the 400 milligrams of indole 3-carbinol each day, had more complete reversal than the women that got the 200 milligrams. As well, indole 3-carbinol supplementation improved the ratio of safe estrogens to the more dangerous estrogens in what is known as the 2 to 16 hydroxyestrone ratio. And no patient reported any treatment-related toxicity or major side effects. Now, further studies of this type are being undertaken, but the takeaway message from this study and the one I presented previously on this subject is that the regular intake of key nutritional factors appear to be an important strategy in helping to prevent the development of cervical dysplasia and cervical cancer. They should be part of your overall global strategy. Moreover, the indole 3-carbinol supplementation has been shown to reverse stage 2 and stage 3 cervical dysplasia in the study reported here. Now, these human studies provide compelling evidence that women should regularly consume cruciferous vegetables and possibly consider supplementation with an indole 3-carbinol containing supplement that may also include other important anti-cancer and immune modulating constituents, as well as taking a high potency multiple vitamin mineral each day. So I've included the reference for this study in the text below. Thanks for watching, and I'll see you next time.